Hey lady, welcome to the Grit, Growth, Grace podcast. If we haven't met, my name is Anne Marie. I'm wife to James and mom to 4 beautiful kids, plus 1 miscarried baby, from 9 months up to 8 years. My hope is to help other women experience the postpartum period all the way up through the first year of baby's life as a time of grit, growth, and grace. This is episode 33. Hi lady, how are you? Hey, I'm so excited to have another guest episode hosted this week, another guest episode host, and it is an international board certified lactation consultant, IBCLC, Jackie Ordner. I have been following along with her content for about 6 months now. I am a nurse contributor to a Facebook group, Facebook Moms group, and she is a lactation consultant contributor to that same group. So I've just been able to interact with and observe her approach, her style, and I found it to be so reasonable and so reassuring. And so I asked her to just share some suggestions for breastfeeding success, and that is what she has done in this episode today. I think you will take a lot away from it, whether you have had one child or more. Or I should say whether this is your first child or you've had several. And I also think she makes a great case for starting your preparation before baby's birth, and not just by taking a breastfeeding class, but specific questions to ask your OBGYN, midwife, whomever it is caring for you during your pregnancy. So I hope you love this episode as much as I did. I'm really grateful to Jackie for sharing her expertise.
Hi everyone, I'm Jackie Ordner. I'm a registered nurse and international board certified lactation consultant with Milk Guide, where I accept insurance to support families with breastfeeding. And today I want to bring you an interesting topic about breastfeeding from hospital to home and how we can really get breastfeeding off to a good start, what steps you can take. And actually the first tip I have for you is before you even go to the hospital. And that is to take a breastfeeding class before baby arrives. And that is because you can get accurate, up-to-date information. Taking a class with an international board certified lactation consultant, an IBCLC, means you are getting the highest level of credentialing when it comes to your lactation support. And that person can help you decipher from the things you're seeing on TikTok or Instagram, or the things you're hearing at the pediatrician's office, or from your friends who are moms. And when you take that class, then you form that connection with somebody who you know is a trusted source for accurate breastfeeding information. I find that it's not that people are seeking to give misinformation. It's just that there's not been a lot known about breastfeeding that has made it into the public realm until recently. And so as breastfeeding becomes more popular, maybe a little bit more trendy, so to speak, it can be really difficult to decipher what is accurate and what is just something that's kind of going around on social media, because moms are trying to support each other, but they maybe need that professional support to kind of help back up. All right, what is really accurate information that you can take to the bank, so to speak, when it comes to breastfeeding, versus just something that worked for somebody and then they put it out on TikTok, but maybe it's not going to work for everybody. So I highly recommend a class for that reason. And not just a breastfeeding class, but if you can take a birth class, and some of the best birth classes I have seen are actually co-taught between a birth professional like a midwife or, somebody who is supporting families in birth, and then also maybe bringing in a lactation consultant who can advise on things like how Pitocin is a synthetic version of oxytocin, and it can absolutely have a role in what's going on with breastfeeding, and not necessarily a positive role. Or how does induction, how does a C-section, how does, a long pushing phase, how do all these aspects of birth play into breastfeeding? So having that education can really help inform your birth plan in respects to breastfeeding as well. And it can absolutely make you think about some things that you might not have thought about. Sometimes we kind of get in the zone of thinking about birth and prepping for birth, but not prepping for breastfeeding as much, or we don't see the crossover from what happens in birth and how birth practices can impact breastfeeding. So those two things kind of go together, and that's before you ever even get to the hospital. Once you are in the hospital, starting with skin to skin is an amazing place to start to get breastfeeding going. Putting that baby skin to skin helps to regulate their heart rate, their respirations, their temperature, their blood sugar. It helps with that oxytocin release. Our natural oxytocin crosses the blood-brain barrier, and it actually does have an impact on bonding. It's not just a feel-good thing, like there is a biological process that happens when that oxytocin is released. And then it helps us release milk. It makes the milk easier for baby to get and creates that happy environment to get breastfeeding off to a good start. It also helps reduce feelings of stress for mom and baby and improves confidence. There are some studies out there that show without a doubt moms who get that skin to skin time and early initiation of breastfeeding feel more confident. Maybe that's because of that oxytocin and how it reduces stress. Maybe it's just getting that early breastfeeding experience sort of under your belt. But prioritizing skin to skin is absolutely something to shoot for. You really want to focus on latch as well. So right away in the hospital, or if you have a home birth, or maybe you're at a birth center, wherever you're giving birth, trying to find somebody who can help you with latch. So a lot of times maybe there's a doula with maybe some CLC credentials, or a midwife who's also an IBCLC, or maybe there's an IBCLC on staff at the hospital. They can get some eyes on that latch and help you, but not just look at how the latch looks, how does it feel, and how is baby swallowing? Are they coordinating their suck, swallow, breathe? Is it a one-to-one suck to swallow pattern? What kind of keys are we looking for here for this good latch? And by good, I just mean that it's effective in milk transfer. It's a deep latch that helps that baby move milk. If we're not removing milk, that is going to negatively impact how your milk supply grows and how you can maintain that milk supply, because we have to remove milk to make milk. Also, a shallow latch is usually painful. Even if it looks great on the outside, if it's painful, that is an indicator that something's not quite right with that latch. So don't think, oh, the nurse at the hospital said this looks fine. If it doesn't feel fine, it's not okay. So definitely don't think you have to just suffer through pain with a latch. That is absolutely a reason to reach out to an IBCLC, get a really trained set of eyes on it, and also some tips and tricks to help improve it. Next, I would make sure that you know what to do in case baby can't latch. Unfortunately, that does happen. I would be out of a job if everybody just gave birth to their babies and breastfeeding went off without a hitch every time. And so when a baby can't latch because maybe there's been some birth trauma, maybe they're born early, there could be all kinds of factors. Maybe there's an anatomical issue inside the mouth. Maybe there's a lot of muscle tension and body tension that's just preventing a good latch. There can be all kinds of things, right? So we need to know what to do if a baby can't latch. The number one skill I recommend knowing prior to giving birth is hand expression. Know your body, know how to get out a little bit of colostrum, even if you're not looking to antenatally collect that colostrum. Knowing how to hand express is a skill that you can use after baby is born if you need to, because colostrum is not easy to get out with a breast pump. It's much easier to get out if you know how to hand express. There's a great video from Stanford University on hand expression. Dr. Jane Morton has some really good resources, and so I would highly recommend checking out Stanford's hand expression video. They're older videos, but the technique is great. So getting that colostrum out, it can be fed to your baby on a spoon, a cup, a syringe. We don't have to introduce a bottle, but we can get baby what they need if we know how to hand express. Sometimes there is a medical need for supplementation. So you can definitely, if you take a breastfeeding class, a lot of times that's something we talk about in class is what are the medical indicators for a supplement. It's not just, oh, baby hasn't fed in a while. Maybe it's a low blood sugar. You know, there are criteria. So definitely kind of having that mentality of supplementing if my baby needs it, and kind of viewing that as a medical intervention rather than just something we move to because it maybe sort of feels like we should. Like we have a set criteria for medical supplementation. And prioritizing that as the World Health Organization does, all the three-letter organizations will tell you, number one, we want to use mom's own milk. If we don't have adequate milk to raise the blood sugar or whatever it is we need to do medically, then we would move to donor milk. If we don't have donor milk, we move to formula. Formula is absolutely life-saving in many situations, and so we view it as such. It is necessary for sure in many circumstances. Um, in addition to that hand expression, and if baby is receiving that supplement, if we don't have enough colostrum to get the desired outcome medically, and we're doing a supplement, we also want to protect the milk supply by pumping. So hand expression is going to get the colostrum out, but pumping is going to provide stimulation to the breast to help bring that milk supply in right after birth. So if baby can't latch, we're going to hand express. We're going to supplement if medically necessary, and we're also going to pump whenever baby would be normally nursing at the breast. So that's going to be 8 times a day for 15 to 20 minutes. So if we, evenly divide that up, that's every 2 to 3 hours. Even though babies don't always eat every 2 to 3 hours, they might eat every 45 minutes, and then every 3 hours the next time, and then every 2 hours the next time. We know that they're going to eat 8 to 12 times or more in 24 hours. So when we're pumping, we want to pump at least that 8 times in 24 hours if baby is not able to latch and nurse. Knowing how to do that will make sure that you can support milk making even if baby can't latch. And so many times when I meet with a family at 2 weeks postpartum, nobody told them that they needed to be doing these things in the beginning. And then mom is crying because her milk supply is low, baby's not latching. But then when we get baby to latch, baby's frustrated because the milk supply is low. So we want to keep that foundation of a healthy milk supply so that when we do work with baby to get them back to the breast, we're not also fighting low supply. We've done what we needed to do to support that milk supply with hand expression and pumping. When you are doing hand expression and pumping, we're focusing on effective milk removal. It takes a few days for that milk to transition from colostrum to transitional milk, and then that supply continues to grow for the first 6 weeks or 40 days postpartum. And whether we are pumping or nursing, we need to focus on frequent and effective milk removal. So we said with pumping, we need to do that 8 times per day. If baby is nursing, we know that babies nurse, again, 8 to 12 times or more in 24 hours. And so skipping nursing or pumping sessions is going to negatively affect the milk supply long term. Sometimes people will think, okay, I'm going to pump every 4 hours instead of every 2 to 3, but I'll pump for 30 or 40 minutes. I think if they pump longer, that they can pump less often and get the same results. In reality, frequency is so important. Frequency and effectiveness. So frequency needs to happen because the longer the breasts are full, the higher the concentration of the feedback inhibitor of lactation, or FIL for short, FIL. That is a polypeptide in our breast milk that the concentration will increase the fuller our breasts are, and it does just what its name says. It inhibits lactation. It tells our breasts to stop making milk because they're full. So even though we might be pumping longer, if we're not pumping often enough, feedback inhibitor of lactation builds, and we are telling our bodies to make less milk. So I'd rather you pump 15 or 20 minutes every 3 hours than go every 4 or 5 hours and pump for 30 or 40 minutes. And we have to make sure those pumping sessions and nursing sessions are effective. So we talked about latch being the foundation of good milk removal. If baby's latch is comfortable, we're hearing lots of swallows, your breasts are effectively drained afterwards, that's great. For pumping, we want those flanges to fit well. Pumping shouldn't hurt. Nursing shouldn't hurt. So in both situations, if we have pain, that's an indicator we're probably not getting an effective milk removal, and there's something not quite right that we need to work on. The next tip I have kind of ties right into what I was just talking about with how often newborns need to eat. We need to know their normal newborn feeding habits. And as I said, newborns need to eat at least 8 to 12 times in 24 hours, and it's good to know how they do this. So it's normal for some feedings to be closer together and some further apart. It's normal for babies to need to feed every hour to 3 hours, depending on what's going on. It's normal for some feedings to be shorter and some feedings to be longer. It is normal for feedings to look different day to day. And it's also normal for babies to have some cluster feeding behavior. So definitely understanding cluster feeding is an excellent tip for you when you get home from the hospital, because cluster feeding is a natural thing that is meant to increase your milk supply, but it can absolutely shake your confidence if you don't know what normal cluster feeding looks like. So cluster feeding is temporary. That's the first thing to know. It happens for a few days, usually surrounding some growth spurts. A lot of times it's not even all day long. It's just kind of the evening hours, perhaps, or a set time period where baby tends to eat more frequently, only taking short breaks. And it tends to happen around these growth spurts. So we have big growth spurts that happen at 2 to 3 weeks, 6 weeks, 3 months, and 6 months. But if we think about how much a baby grows, how rapidly they grow in the first year, and really in the first 6 months, they're kind of in a constant growth spurt. So it's going to feel like cluster feeding happens and you get through it, and next week it happens again. So just know that as long as it's temporary, we're having some definite periods where cluster feeding isn't going on, and then we kind of go back to cluster feeding. That's all normal, and it shouldn't be like babies constantly at the breast around the clock all the time. That would be an indicator something's not quite right. But these temporary little spurts of cluster feeding, they're par for the course, but they can shake our confidence. So just know that it's a normal part of breastfeeding. If you're worried about your baby's intake, are they getting enough? We are definitely looking, again, are your breasts feeling softer after feedings? Are you hearing lots of swallows? Are they making adequate diapers? After day 3, they should be giving you lots of wet diapers, so 6 to 8 wet diapers, and after day 3, giving you 3 to 4 or more dirty diapers. And those dirty diapers, by the end of day 4 of life, they should be mustard yellow if you are breastfeeding. And so that's a great kind of milestone to hit. If we're still seeing brown or green poops at the end of day 4, that's an indicator baby might not be getting enough. So when you're dealing with cluster feeding, knowing some of these signs that baby is getting enough milk are huge. The number one way to know that they're getting enough is to track their growth. So as a lactation consultant, that is one of the biggest tools I use. I bring my scale. It's sensitive to 5 grams, which is not hardly anything. And we are tracking that baby's weight on a growth curve. We are seeing how it changes week to week and ensuring that baby is getting enough milk. And then they should be back at birth weight by about 2 weeks. So they have initial weight loss, but we are turning that tide. By day 5, I want to see them gaining, and then by 2 weeks back at birth weight. And then just a final tip to wrap things up. It is so much easier to get through those early days and weeks and months of breastfeeding if baby is close at night. So keeping your baby close at night means you're able to respond to hunger cues so much more quickly, and the less upset baby gets, the easier latching goes, the better feedings we tend to have. And if they get really upset by the time we get to them in the middle of the night, they can just get to the breast and sort of shut down and fall asleep because they're comfortable enough at the breast, but they haven't really gotten in a good feeding. So keeping baby close, responding to those hunger cues early at night is really important. Learning to nurse lying down in that side lying position is going to be a game changer. You can rest your sore neck and shoulder muscles. You can just rest in general. Babies often latch well, even if they've had some trouble latching. Putting them in a side lying position can be a game changer because they have this continual support under their body from the mattress, and that can help them just kind of relax, release some tension, and get a better latch. So it's a great way to try latching. And moms who keep their babies close at night actually report improved sleep quality and sleep length because they sort of sync up with their babies. If baby's at arm's reach, maybe they're in a co-sleeper bassinet and they're just at arm's reach, or maybe you're practicing the Safe Sleep 7 and there's a lot of evidence to show, co-sleeping under specific circumstances can be really safe. If you're doing that, you're syncing up with your baby biologically. You're both going to wake up a little bit easier on the same sort of routine, and you're not going to feel jarred awake in the same way that you might if your baby's all the way down the hall and you're hearing crying on the monitor. So there's a lot of benefit to keeping baby close at night, and learning to sleep or learning to nurse in that sideline position so that you can rest a bit. It's great for both mom and baby. So I know this has been kind of a quick rundown for some of these tips, and it's a lot of information, but hopefully this gives you an idea of some ways you can move from hospital to home and get those basic foundational parts of breastfeeding going so that you can have a great breastfeeding journey. That foundation is so important. I wish you all the best. Thank you so much.